Kelly Edwards.
Yeah, that's me.
Hi, I'm Bryce. I'll be your nurse for today. How have you been? I haven't seen you in about 6 months.
I'm doing alright, just a few aches and pains that go along with getting old.
Let's take a look at your health history and see if everything looks good. We have to do this with all of our patients. Would you mind if I ask you a couple questions about your drug and alcohol use?
Yeah, sure.
Okay, Kelly. Do you smoke at all?
No.
Okay, great. So in the past year, have you had 4 or more drinks in a day?
Yeah.
Okay, and in a typical week, do you have 7 or more drinks?
Well, it depends, but most weeks, yeah.
And in the past year, have you used marijuana, other street drugs, or recreational drugs for non-medical reasons?
No.
In the past year, have you drank more than you meant to?
Yeah, but only a couple times.
And in the past year, have you thought about cutting down on your drinking use?
I mean, it's crossed my mind, but I don't really think it's causing me any problems.
Okay, one last question. In the past year, have you ever been intoxicated on alcohol or drugs when you could hurt yourself or others?
Yeah, I have, but it doesn't occur often at all.
Okay, if it is okay with you, I would like to be able to talk more about that. Is that all right?
Yeah, sure.
When you first checked in, you mentioned that you had 3 drinks a day and sometimes more than 7 in a week. Is that about right?
I mean, yeah, I guess. Why does this even matter? I thought this just was routine.
Well, based on your average daily and weekly intake, you exceed the safe limits for alcohol use. I think it would be beneficial to your health if we just spent a few more minutes talking about your drinking habits. Could you tell me more about it?
I mean, I am an adult and I like to drink with my friends. The bar seems pretty fun too, to go to a couple nights, and especially since I'm single. After work, I'll drink a couple of beers, just kind of unwind, and it's fun, and there's always seems to be alcohol around when I'm with my friends too.
Okay, so it seems to me like that you enjoy drinking with your friends. Is that correct?
Yeah, I guess you could say that.
And it sounds like you like to drink after work to help you relax.
I mean, it helps me unwind after a long day, but why? It's not like I have a problem.
Well, for a healthy female under the age of 65, a healthy number of drinks per week is 7, and you seem to be exceeding that. Because you're drinking more than that, you seem to be at moderate risk for illness or health problems.
Oh, I guess I never realized that.
What I would really like you to do is think about cutting back on your alcohol use just a bit. Would you possibly consider that?
Yeah, I guess I could try.
Like a pain scale, I have a scale called the readiness ruler that helps the patient and I understand how ready you are for change. A 1 is not ready to change, and a 10 is very ready to change your drinking habits. Do you mind if you would point to me and tell me a number that would describe you if you were ready to change some of your drinking habits?
Well, it's kind of tough, but I guess right now I'm probably like at a 4.
Can you tell me why you said a 4 as opposed to a 2?
Well, I've thought about cutting down on my drinking before, but I haven't been able to make the change. I don't think I'll ever be able to do it.
In other words, you don't believe you'll be able to go through this process of change?
Yeah, I think that'll be really difficult.
So you don't feel like you'll be strong enough?
Yeah, I don't say I can change my habits at this point.
I understand this is difficult and change can be hard. So what are some things that appeal to you about drinking?
I mean, like I said before, it's just always there when I'm with my friends and helps me unwind after a hard day at work and all the bars. It kind of gives me a little liquid courage to go talk to guys.
If I'm hearing you correctly, you were saying that most of the time you're with your friends, alcohol is involved?
Yeah, definitely more times than that.
And you feel like without alcohol, you have a hard time talking to men? Is that right?
Oh my gosh, wow, this is really embarrassing, but yeah, sometimes I feel like I really need it in order to start a conversation.
I can see how alcohol could help with talking to men, but what are some things you really don't like about drinking?
Well, I can get out of hand sometimes. At an office party recently, I had a little too much to drink and I was told that was pretty embarrassing. I also tend to drink past my limits on work nights, so sometimes when I wake up I feel a little groggy and I'm not at 100%. I mean, it's pretty expensive to keep drinking as much as I do too. I know my boss wasn't very happy with me at the party. I guess I was pretty unprofessional.
Okay, so it sounds like to me that drinking can sometimes get in the way of your job. Is that right?
Yeah, I could probably get more done if I didn't drink on weekdays.
So it seems to me that you really care about your job and you want to be successful. but your drinking can sometimes negatively impact your performance.
Yeah, that's it.
If you were to change your current behavior, what do you think would change for the good and bad?
Well, I mean, if I were to stop drinking and going out, I'd probably be able to focus a little more on my career and even save some money, probably, definitely. I could focus on the aspects of my life and maybe even look at getting a hobby or something like that. But the hard part is my friends. Me and my friends really like to go out, and if I stop drinking, I'll lose time with them. And I would also lose the courage when I'm drinking to talk to other people.
So if I'm understanding you correctly, you're worried that you won't be able to spend as much time with your friends,
Yeah, I don't know what I'll do while they're drinking.
but you also feel like you would save a lot of money if you didn't drink as much, right?
Yeah, I could definitely use that money for something else, like getting me a new car.
Well, Kelly, I'm very proud of you for being so open. Do you mind if I ask you another question now?
Yeah, go ahead.
I would like to refer back to the readiness ruler that we used before, now that we've talked about some of your pros and cons of drinking. Remember, 1, you're not ready to change, and at 10, you're very ready to change. Do you mind if you would point to the number that would best describe if you were ready to change some of your drinking habits?
Okay. Now that we've talked about it, I'm probably at like a 6 now.
I'm very happy for your openness to change. Why did you say a 6 as opposed to a 4?
Well, talking about the pros and the cons that go along with my drinking, I think I would save a lot of money and I'd cut back on a few drinks per week. I'm really trying to save up money to buy a new car, like I had said, and who knows how much I'd save if I cut back. I also hold a great job as a paralegal, and I should definitely represent myself better at the firm. And it was pretty embarrassing to hear that story at the office party and how I acted. I really tried to control my behavior while drinking in the past, but it seems like I keep just going down the wrong track. And now that I have a goal in mind, I think, like my new car, I just feel like I can be more committed to the plan.
What I hear you saying is you care more about your job than your alcohol consumption. Is that correct?
Yeah, my job is like my world, and I really would not want to lose it because of another embarrassing office party.
And it sounds like you're pretty excited at the thought of saving money for a new car.
Yeah, that would be so nice. My car's about to break down, I think.
Well, those are all great points, Kelly. Could you maybe tell me some steps that could help you cut back on your drinking?
Yeah, well, I guess to start off with, I could use the money that I use at the bar and put it towards like in a jar or something for a new car, and then that way I'm saving money and not drinking as much. It's like a win-win situation there. And I could also cut back on drinking in general on weeknights so that I'm at my best when I go to work. And I could also start keeping track maybe and see how exactly much I'm drinking along with how much I'm spending as well.
Those are great attainable goals, and it is very strong of you to recognize the need for change. You have accomplished a lot in your life, and I think you're up for this challenge. I think it would be great if you kept track of those goals and come back to see me in 6 weeks. How does that sound?
That sounds good. I'll definitely try to keep track of my goals. Thanks, Bryce. I feel a lot more confident now that you talked to me.
Now, what you have said is important, and I want to make sure that I have it all right. So you are going to set aside money you would spend at the bars for a new car, cut back on drinking during weeknights, and keep track of weekly alcohol intake.
I will definitely try my best to reach those goals.
Well, Kelly, I'm sure all of this information seems very overwhelming and out of the blue. So I really appreciate you taking the time to talk to me today and being so open to this discussion. I believe that you'll be able to reach those goals. Now let's get you all signed out.
Yeah, thanks again. It definitely helped me a lot.